Hey everyone, it's Dr. J with Dental Masters, and today we're going to talk about bone. That's right, bone. Let's talk about what are your teeth actually attached to. Well, you might have guessed, they're attached to your bone. Let's go a little bit into some detail about that. So teeth basically have little ligament fibers that attach to the bone. This is what stimulates the bone. It's how we can move teeth with braces by pulling on the ligaments to grow bone, and it's what's responsible for maintaining bone. The teeth are attached to the bone with ligaments, so the teeth maintain the bone and the bone support the teeth. So it's a really important symbiotic relationship. You have to have healthy bone to maintain your teeth, and you got to keep your teeth healthy to maintain your bone. So why is gum and bone health important since we're speaking and talking about the mouth? Well, for starters, the gum and bone is kind of like the open or the starting point really for the digestive tract and really for a lot of things. So bacteria can get in to not only support the teeth and the gums to protect the teeth, but it also is there for aesthetics. What I mean by that, so your bone and teeth actually support your face, your lips, your cheeks. So if you lose your teeth and you lose your bone, then you'll start to get this sunken in appearance in spots where the teeth are missing, whether it's one tooth or a row of teeth, and it really starts to have you prematurely age. You start to get some wrinkles and some soft tissue on your face that can collapse. That's from an appearance standpoint. Bone is important also for, you guessed it, chewing. You have to have solid bone to support the teeth so that you can chew your foods properly. If the bone is not healthy and the teeth start to loosen up, it becomes difficult to bite into an apple or to chew steak because the teeth are moving, and that can cause discomfort as they're moving around an unhealthy bone. So bone health is important for a lot of different reasons: appearance, chewing, and overall health. So what are some of the reasons that may cause poor bone health or loss of bone, and really what does that mean for you? So there's a couple things. You could have what's called periodontal disease, or you may have heard gum or bone disease, and that's when you have a specific type of bacterial infection. It's a infection that is around the teeth where the teeth connect into the bone, and what happens is your body's immune system trying to get rid of this infection, the attachment apparatus we call it, you can get what's called a bacterial infection, which we call periodontal disease. And how your body responds to that, and this is somewhat to genetics, and it's also getting rid of the bacterial infection, is really important. So with this bacterial infection, if you have the genetics that allow for this, your immune system will come out and actually attack the bacterial infection, and while that's happening, it actually will melt or eat away the bone. And that's what periodontal disease is. It's having bacteria and plaque on your teeth, but also having the genetics that make your immune system attack the bone. That causes you to lose bone, which becomes a disadvantage because then you may get some of those things like sunken face appearance, loose teeth, and discomfort chewing. Other ways that you can lose bone is when you have a tooth extracted, there's always going to be some bone loss. Even if you have bone graft, or we call it a socket preservation bone graft, where we're trying to preserve as much as possible, when a tooth is taken out, you always lose a little bit of bone. And the third way that we see bone that can be lost or damaged is long-term denture wearing or partial denture wearing. And that's because this plate that sits on your gums and bone, over time, you chew on it and it really starts to melt or resorb away the bone. So what does this all mean for you if you have unhealthy bone or you've lost bone? Is getting implants becomes maybe more of a challenge when you're trying to put teeth back in place if you've lost teeth. So there is solutions though, that's the good news. I've got many solutions and ways that you can address this. So a couple things that we can do. If you have bone loss and maybe you're trying to replace a tooth, a single tooth or a couple teeth, it's in the upper jaw and you've lost bone around your sinus, we can do sinus bone grafting and actually grow your bone back. Really any place in the mouth we can grow bone back, and it's a procedure called guided bone regeneration. It's something that we do all the time here and it yields excellent results. Now obviously if we can take care of the bone ahead of time and you're blessed with good genetics, it's a better way to go, but don't be discouraged, we can grow that bone back. Some people went to someone, they told me, I don't have enough bone, it's going to require really extensive grafting. Is there any other solutions? Well, for replacement of a full row of teeth, there's what we call remote implant placement, and that's where we will anchor implants in different parts that are besides your jawbone, such as the cheekbone and other spots where there is healthy bone, and those implants end up coming into the mouth in a proper spot where we can put the teeth back into place. So bottom line is bone health is really important. Maintaining your bone is really important. However, if you you've been through some things and life has happened, don't be discouraged. Come in, get a consultation, talk to a dentist, and see what your options are, because there's always a way to grow bone back or to find a way to put implants in so you can get your teeth back, get your smile back, get your confidence back, be able to chew again. So that's a whole lot on bone health from start to finish. Hopefully this is helpful for you. If you have any questions, feel free to drop it in the comment section or come and join us for a consultation at Dental Masters. This is Dr. J.